A nurse did something very wrong here, and I need your help figuring this one out. A lot of nurses and nursing students are going to think they know this and think it's obvious, but it actually is not. This is a NCLEX case study of a nurse that comes onto shift and she assesses her patient at 0800. She sees this, okay? The patient has been on IV fluids and had a vancomycin infusion at 0200, 2 o'clock. There is no documentation of IV site checks since 0300, 3 o'clock. Patient has IV fluids infusing now, but with severe pain. Patient reports severe pain and burning at the site, and on assessment, you see erythema and edema, and it looks like this. What do you think is the most likely thing going on with this patient? You have 3 seconds to answer. 3, 2, 1. This is an IV extravasation. It often gets very mixed up with something else, so stay tuned for the other 3 questions. What do you think caused this extravasation? Given this case study, what in here led you to believe that this is an extravasation? You have 3 seconds to answer. 3, 2, 1. This is usually from vancomycin. Vancomycin is a known vesicant. A vesicant is something that will burn the inside of the vessels and cause the medication to leak into the tissues. And vancomycin is a rough medicine. It can actually tear up the skin here. What do extravasations often get confused with? You have 3 seconds to answer. 3, 2, 1. They often get confused with infiltration. So let's talk about the difference between the two. So an infiltration is when the IV fluids are infusing and it's not a known vesicant. So it goes into the surrounding tissues, it accidentally pokes through the vessel or comes out of the vessel, and then that IV fluid is going to start filling up inside the tissues rather than inside the vessel. Typically, it's going to be cool and pale. It may be a little bit uncomfortable, but not severe pain or burning. Versus an extravasation that is actually quite painful. This is from a known vesicant and causes severe pain, burning, swelling, redness, blistering. This can get very, very bad to the point where it will cause necrosis of the tissue, and we have to do skin grafts and remove a lot of that dead tissue. So this can be actually very serious. What is your nursing priority for this extravasation? What are we going to do for this? First thing you're going to do, you have 3 seconds to answer. 3, 2, 1. You are going to stop the IV, discontinue, we're going to remove it and call the physician because we are going to need to probably get a wound care team out here.